many great results. I worked for 10 years with LaesEr Bioresonance. I had 2 devices of LaesEr, but I don't work with those devices anymore. I get great results with Borrelia, with Lyme disease. I got one woman, she was 65, she is 65, and she was suffering from Borrelia for nearly 20 years. She had also Borrelia in her head. There were scans where they can measure the aarde, hoe zeg je dat in het naam? De Borrelia in de yes, so you see the different Borrelias sitting in her head with MRI scans, and she was, years after years, she was treated with antibiotica by the
neurologist, yes.
Yes, but it doesn't work. She had paranoia, anxiety, tiredness, every pain. I said, yes, first you can come to me, but you have to stop with antibiotics. Discuss it with your doctor, and if it's all right. She did so, and I treated her with the core frequency program with Borrelia, but also with biofeedback with magnets and laser generator and
Biolaser also, Biolaser.
No, not yet. Not
I see.
that
Okay.
before that.
Mm-hmm.
Sorry. And within a year, she was way better. Felt in 3 months she felt more energy in her body. Within 4 or 5 months, she had almost no pain. And almost a year later, they took an MRI scan again in the hospital, and she had no more Borrelia in her head, in her brain, and she's cured. That's one remarkable result in a very short time. For the other devices, it cost some years with treating Borrelia.
And since how long do you have the laser now?
Since 1 year.
1 year. And then, like, what do you think changed? In what way changed your work since then?
You see people changing in treatment with the core, normal core. You also see people change in half an hour working. With the biolaser, you see a deeper connection with their cells. You see that they are more connected to their cells. But it's hard to explain this. It's also with the core. You see a connection, you see changes happening.
But do you use the biolaser only for specific people, or everybody is on the biolaser?
Not yet, but it's going to change after this seminar.
So until now, what did you do? Only
I treat person with MEMA, chronic fatigue disease. I treat people with disorders in the brain, with burnouts, and I get very good feedback of the people, more energy, feel more complete.
And you said yourself had, like, 4 weeks ago, this was also very surprising to me. What did you have 4 weeks ago? Your own?
3 weeks ago.
3 weeks ago. Tick bite, yes.
And I the next morning discovered the thing was a nymph, the women from the tick, the women from the tick. And since then my immune system fell down. I started, I think I had a little bit of longontsteking. And 2 weeks, very much fever, tired, pain in my bones, but I've got my patients, 20 patients a day, so I have to work as well.
20 patients?
18 to 20, yes. So at the evening, I set 1 hour at the biolaser to recharge my battery, and then it was normal again.
So I mean, that's the best. I mean, that's the best testimonial, but usually that's the one forgets first, oneself. Yes. Imagine this is a very good example. I think how, and actually every healer, the greatest challenge is not to lose yourself in all the problems of the people that come to you, and that's why, especially cancer doctors, those people who have terminal illnesses, there's a very high percentage of those people who get the cancer themselves, but not, of course, not because there's the cancer virus. It's because it's information that is, you are contracting this, especially if you have a lot of compassion. But it's always the deal to be both compassionate and then at the same time also having your own sense of self. So, and I think that's very, very good.
Can you
Yes.
ask, how do you, when I come to you with a headache or something else, what do? You scan 5 minutes, 10 minutes,
Yes.
and then? Because you have 20 patients a day.
Yes.
Yeah?
And then I put you.
I'm very curious, yeah?
Yes, yes, yes. The nice thing with the first consultation is you ask what's your history with diseases, and you make contact with you. You scan with the core for how the organs are, how your emotions are, excuse me. In the last time I didn't change it all. Sorry anymore. Afterwards, the next 50 minutes, I set you a biofeedback, and we can also talk with each other, you know.
So 50 minutes you have people sitting on.
The first time.
50 minutes on the biofeedback on what? On the laser or?
No, the biofeedback.
Which we,
The
frequency, yeah, frequency. So really you have them treated with electric impulse, or only auto communication, only the, or with also electrodes.
No, the biofeedback with the new screen of you.
Ah, yeah, but you use the health navigator then.
Yes.
Ah, yeah. So then they are on their own, or you are sitting with them?
I'm sitting with them and talk to them as well.
50 minutes.
Half an hour. First 10 minutes of talk with them, and then we put on the biofeedback.
Okay.
A couple of weeks later, or 4 weeks later, we do it again. But that's going to change now as well, because I saw Marco.
Yeah. Very good. Okay, thank you.
And you see them back 4 weeks later?
Most of the time 4 weeks later, yes. Sometimes within 2 weeks. Depends on if they have cancer or Lyme disease, then I see them more often.
And people with CVS and fibromyalgia, you also wait 4 weeks?
Yes, most of the times, yes.
But then like a general consultation with you is like 45 minutes or something?
30 minutes.
30 minutes, yeah, of course, with 18 people. Very good. Okay, thank you very much. Thank you.
Dus, hè?